Meanwhile, thank you very much, ladies and gentlemen who have registered, who have already logged on. You are logged on to the first webinar series of the Uganda Strengthening Supply Chain activity. A USAID funded activity, and our moderator is going to be Mr. Charles Odongso, the gentleman who has just been talking. I will hand over to him to take us through the formality of starting up and moving forward with the webinar. Charles, you're welcome. Charles is the Public Relations Officer for the Ugandan Office of the Prime Minister. He's the spokesperson for the Prime Minister's office, and his full name is Charles Odongso. He will lead us today in this seminar by being the moderator. We have altogether 4 panelists, including Charles. We have 6 active panelists on board now. So Charles, the mic is over to you. Welcome on board. Thank you very much.
Thank you very much, Martin. And from Uganda, it's a good afternoon. It's just 10 minutes past 3 p.m. here, local time in Uganda. And I want to welcome all of you to this webinar. Like Martin has said, this is the first webinar of a series that will be discussing different topics. Today's topic is promoting local ownership and sustainability of Uganda's supply chain system through the 10-year roadmap. Just to bring you up to speed, the roadmap was commissioned or launched some 2-3 years ago in financial year 2021-2022, and it was launched through a high-level task force, ministerial task force on the health supply chain. I want to start by recognizing the participants attending today's webinar. We will have government officials, we have policymakers, the academia, researchers, civil society representatives. We have the private sector represented, development partners, and implementing partners. Our webinar is going to be to take us about 1.5 hours discussion. We will have presentations by the panelists. Then we will have some questions and comments. First, I want to say, I want to state some ground rules, a few housing remarks for our discussion. Ensure that your internet connection is stable for you to effectively listen in and contribute during the webinar. We will have this webinar is recorded, just so you know, it is recorded, it is on the record. And after the session, the recording can be made available to all of us. Kindly familiarize yourself with the Zoom platform so that when it is not your turn to speak, you stay muted. But when you want to talk, you will raise your hand, and then when your hand catches my eye, or the technical people assisting me, we will pick on you to make your comment. The chat feature is active at the bottom of your screen. Please use it to let us know your name and where you're joining from. It's important we know where you're joining from so that we can recognize you accordingly. We encourage you to use the chat throughout the session, and feel free to ask questions. from any of our speakers or share your insights as we move along. We want to hear from each one of us. All the participants have right now been muted at entry into the webinar and will only be unmuted when they raise their hand during the plenary question and answer session. Our team will be collecting the questions, and after our speakers' remarks, we will have time for audience Q&A. And please do not hesitate to ask any questions, as I have already said. Let me re-emphasize and recognize that this webinar has been organized by the Office of the Prime Minister of Uganda in partnership with the Ministry of Health and other ministries, departments, and agencies, with support from the USAID-funded Uganda Strengthening Supply Chain Systems activity that is implemented by the Management Sciences for Health, Advocates Coalition for Development and Environment, and the Uganda Healthcare Federation, the UHF. Our panelists that are already set for the discussion include Mr. Edward Walugembe, who is the Commissioner for Strategic Coordination and Implementation, Office of the Prime Minister. We also have Dr. Victoria Nachiganda, Program Management Specialist of the Supply Chain, under the Supply Chain USAID Uganda Project. We have Dr. Eric Lugada, who is Chief of Party, Strengthening Supply Chain Systems Activity, a project which is funded by USAID and implemented by Management Sciences in Uganda. We also have Dr. Martha Ajulong, the Assistant Commissioner, Pharmaceutical Supply Chain and Logistics, Ministry of Health. We will also be joined by, he has been traveling, but if he's available, we will be joined by Mr. Musimenta Boaz, who is a principal policy specialist with the Prime Minister's office in Uganda. Ladies and gentlemen, from wherever you are joining us, allow me now welcome Mr. Edward Walugembe, the Commissioner in Prime Minister's office in charge of strategic coordination and implementation, to start us off with a 5-minute presentation. Mr. Walugembe, please.
Thank you very much, moderator. Good afternoon, ladies and gentlemen. Good morning from wherever you are. It's my pleasure to welcome you all to this webinar, in which we share the journey, experience, and achievements during the past 3 years of the 10-year National Health Supply Chain Roadmap. The period we are sharing about is 2021, 2022, 2023, 2024. The 10-year roadmap covers the period 2022 2032 and was worked to enhance health service delivery in the country by ensuring the consistent availability of health commodities to meet the health needs of the population. Frequent media reports highlighting public complaints about poor care at health facilities, particularly lack of medicines and related health supplies. Effective implementation of the roadmap will strengthen the local capacity and ensure the sustainability of development outcomes in the health supply chain system. Like many other national development programs and consistent with the mandate as provided for in the Constitution of 1995, Article 108A, Office of the Prime Minister is privileged to coordinate the implementation of the 10-year National Health Supply Chain Roadmap. And I want to add that within the policy framework, we have the policy coordination policy of 2016. So we use this to effect the coordination role of Office of the Prime Minister. And this works through a dedicated interministerial task force, which we call the IMTF, on the National Health Commodity Supply Chain. It is composed of key ministries, departments, agencies, the private sector, civil society organizations, and health development partners. OPM, Office of the Prime Minister, is coordinating the supply chain and required efforts beyond the Ministry of Health. The supply chain issues require efforts beyond the Ministry of Health. So the solution to the supply chain issues are beyond Ministry of Health and involve everybody. Therefore, OPM being the coordinator of government of Uganda brings in other ministries and departments to participate and contribute to the overall success of the roadmap. And as I said, this roadmap is implemented not only by the government side, but by the whole of society, because we have all the other players together with us. So the IMTF guides and advises the government of Uganda on health supply chain management, financing, and governance. It's my pleasure that today we are sharing and discussing the progress of implementing the 10-year roadmap journey at 3 years. So we shall be reviewing ourselves where we are and continue to improve until we reach the destiny in the 10 years as planned. So I wish everybody good deliberations. Thank you, moderator.
Thank you very much, Commissioner Walugembe. Can we now have the Chief of Party of USAID SSCS activity, Dr. Eric Lugada, to talk to us?
Thank you so much, Charles. Participants, welcome to this webinar this morning. I'm called Dr. Eric Lugada. I'm the Chief of Party for USAID-funded Strengthening Supply Chain Activity, which is implemented by Management Sciences for Health in Uganda. When we set off, we were tasked to improve the supply chain system in this country to enable availability of essential medicine and health commodities throughout the country and also be able to track and trace. We had 3 result areas. The first one was to perform a targeted improvement into the supply chain systems by strengthening the system, by building capacity of the actors, and also enabling them to do quality work in order to avail essential medicines to all participants, all Ugandans at any one time. And the second one was to support governance and leadership so that we can improve the quality of care and the quality of service and stewardship for supply chain. And then the third one was to begin to localize the supply chain system within our country so that the country takes ownership of supply chain and begin not only to fund it, but to manage, govern, and moving forward, sustainably be responsible for the supply chain systems in our country. We developed a strategy, and the strategy to address the result area number 3 was through a 10-year road supply chain roadmap that we are discussing today. It was the strategy to localize the initiative, which was designed to revolutionize our supply chain system so that we can ensure the efficiency, reliability, and sustainability in the long term. The roadmap harnesses development investments of local partners, and also we draw on the local financing while we strengthen capacity of our government ministries, departments, and agencies to independently and efficiently manage the supply chain system in the country. If you looked at our budget before 3 years ago, about 70% of essential medicine and health commodities were funded by development partners, and 30% was funded by the government. So we set out to reverse this trend, begin to use local resources to support our own supply chain system. We adopted an approach that designed a 10-year roadmap with clear steps and milestones which will be achieved along set goals. The milestones are divided into 3 tranches at 3 years, at 7 years, and at 10 years. And we leverage the cornerstone of the Uganda's One Government approach, which was adopted about 14 years ago. This approach promotes a unified and collaborative effort among various ministries, line ministries, to achieve national objectives. And the line ministries, which influence health in our country, include the Ministry of Health, the technical oversight. It includes the Ministry of Finance, which provides resources. It includes the Ministry of Local Government, who govern and manage health facilities within the district, so they are responsible for oversight of the health facilities throughout the country. It includes the Ministry of Information, Communication and Technology, responsible for providing internet, which internet is the fiber which will run the digital systems that can enhance visibility and reporting of health commodities. It also includes the Ministry of Public Service, responsible for defining the relevant cadre to be employed within the health system. It also includes the Ministry of Energy, responsible for providing energy to run the digital systems within the country. And finally, it also includes the Office of the Prime Minister, who is the lead of business government and who takes oversight of all ministries. So this one government approach adopted 6 areas. One was enhanced interministerial collaboration, which we did through the interministerial task force. And we had integrated planning and resource sharing, which helped us to inform the Minister of Finance how much money was required to add to the national essential medicine supply docket so that we can improve supply chain systems in the country. We are able to also establish a joint robust monitoring and evaluation mechanism within the interministerial task force so that we can be able to track and trace, but also improve service delivery jointly with the ministries which we are concerned. We build capacity, enhance the capacity of staff both at the national and sub-national level, and we also introduce technology to be able to track and trace with both computers. We connected them, and now we are collecting data using a digital platform. And finally, through this one government approach, we are promoting transparency, accountability of governance, and judicial use of resources. We expect that at the end of the day, we have a locally involved, efficient, and responsive government to foster national development. And this is going to be done along the roadmap in the next 1 decade so that our systems, supply chain systems, are resilient and support economic growth, but more importantly, enable access to health commodities for all Ugandans wherever they are. Thank you.
Okay, thank you, Dr. Lugada. Can we now hear from Dr. Martha Ajulong? Dr. Martha Ajulong is the Assistant Commissioner for the Pharmaceutical Supply Chain and Logistics at the Ministry of Health. And that is the Secretariat and the main technical ministry in charge of the development process of the 10-year roadmap. Dr. Martha?
Thank you very much, Mr. Moderator. It's true that the Ministry of Health was and remains at the center of the development of the process of the 10-year health supply chain roadmap. And the Ministry of Health is the Secretariat and the main technical ministry in the implementation of the 10-year health supply chain roadmap. So how did this supply chain roadmap begin? We had the stakeholders that agreed to the constitution of an interministerial task force, which we call it the IMTF, and the subcommittee of the subcommittee was formed that would provide technical leadership and guide the roadmap development process. So the interministerial task force subcommittee made a method of work, included the setting up the agenda and prioritizing the key supply chain activities, conducting all the necessary consultations, and finally drafting and presenting the draft of the roadmap, the 10-year health supply chain roadmap, to the interministerial task force committee, which is owned and managed by the government of Uganda. And it was approved by the 10-year health supply chain roadmap was approved by the interministerial task force team. So having developed this roadmap, the draft, it was launched January 2022. And the important lessons that we have learned so far were the institutionalizing and alignment of the roadmap with other national documents. So we find that the roadmap is aligned to the government of Uganda's National Development Plan 3, which is a 5-year document, 2020 to 2025, and the Ministry of Health Strategic Plan, also 2020 to 2025. The 10-year health supply chain roadmap has 8 strategic pillars. Namely, We have the health commodity supply chain management as a pillar, the human resources for health supply chain, the infrastructure, warehousing, storage, and distribution, the quality, pharmaceutical quality, pharmacovigilance and waste management, health supply chain information systems, health supply chain policy and governance, resource mobilization and financing of the health supply chain. The health supply chain document, the 10-year health supply chain roadmap, is a multi-sector. So we have a multi-sector approach that we used. The power of the synergistic interventions and benefits of the multi-sectoral collaboration and partnership, alignments and elimination of the silo approach to the government investment in the key strategic services like the health supply chain strengthening. Why are we talking about elimination of the silo approach? Previously, we had the Minister of Energy and Mineral Development, Minister of Information, Computer Technology doing their own things, Minister of Health also doing their, having the digitalization separately. But now we want to come together and leverage these resources to achieve a common goal. So this approach of the One Health, which approach we are using, is also referred as the One Government approach, which remains as the critical, which is critical in the whole implementation of the architecture of the 10-year health supply chain roadmap through the interministerial task force team as a platform. We have the ministries, departments, and agencies are interrogated. The plans are interrogated from different ministries, departments, and agencies, and the supply chain activity reports that support the Ministry of Health, such as building capacity at the district level, incorporation of the supply chain indicators in the Ministry of Local Government, inspection tools, and mentioned, but those two that we have. So the One Health approach brings the government of Uganda, ministry, departments, and agencies as a single entity to achieve a common goal of having modern, resilient, and donor-independent health supply chains for Uganda. So the One Government approach will maximize the use of existing resources, competencies, and capacities within the different ministries, departments, and agencies, and local governments to implement the Uganda's health supply chain priorities. So the roadmap, the 10-year health supply chain roadmap development, was also guided by the principles of addressing equity and efficiencies in the earlier years. We have the gradual and prioritized transition, government of Uganda to increase both financial allocation and leadership to the different aspects. We also had the principle of innovations and ambitious targeting, considered strong aspects of integration through innovations and being ambitious. That is our 10-year health supply chain roadmap. So this led, at the end, we find that the relevant ministries, departments, and agencies, together with the district local governments, are required to incorporate the health commodity supply chain key priorities into their strategic plans and their annual work plans and budgets. So far in our 3-year experience, this approach of the One Health approach has led to the ministry, departments, and agencies to appreciate the importance of the synergy in strengthening the health supply chain, to build strong and responsive health services delivery, ensuring sustainable implementation of the roadmap priorities. It has demonstrated that and realizing efficiencies in the allocation and utilization of the available limited resources within the government, ministries, departments, and agencies. And so far, set the ground for the government of Uganda sustainable agenda implementation in the health sector. Thank you.
Thank you very much, Dr. Martha. Can I now hear from Mr. Musimenta, or is Mr. Walugembe going to stand in for Mr. Musimenta before we bring in the questions and we move to that stage? Mr. Walugembe?
I'm standing in for him.
Okay. Please go right ahead. We need to hear from Musimenta from his role as a policy analyst. We want to hear from the responsibilities that he plays and the experience he should share with us in coordinating the implementation of this 10-year National Health Supply Chain Roadmap.
Thank you, moderator. We've had 10 interministerial task force meetings convened, and these meetings have discussed the implementation of the roadmap, guided on the health supply chain management, financing, and governance critical issues for effective implementation of the roadmap. Number 2, ministries, departments, and agencies, national planning and budgeting retreats for the 10-year health supply chain roadmap priorities. Then to change management process required to break the vertical method of work among MDS, ministry, departments, and agencies. Though challenging is surmountable and leads to yields good results. Having a common performance monitoring framework for the ministry, departments, and agencies to account for the implementation of their commitments contributes to gradual but essential changes in their method of work. That's the starting point.
Okay. Is that all?
Okay, the next point is what has been achieved in the last 3 years.
Yes.
Number 1, Ministry of Finance or government has increased the budget allocation to essential medicines and health supplies from 544 billion shillings in the financial year 2021-2022, and this is 30% of the domestic financing, to 740 billion shillings in the financial year 2024-2025, from 30% to 36%. The Ministry of Energy and Mineral Development connected 317 out of the committed 830 public health facilities and 73 districts under last mile connectivity in the medium term. And in addition, 340 private, not-for-profit and private for-profit health facilities have also been connected so far. And this is to the grid. The Ministry of Information, Communication and Technology and National Guidance, as well as the National Information and Technology Authority, has connected 119 health facilities out of 600 health facilities committed for the national backbone infrastructure in the medium term. Ministry of Health and Ministry of Local Government have also played a role, and these have been coordinated. At least 85 districts and 18 hospitals have now incorporated supply chain activities in their financial year 24-25 annual budgets, and to look at past building them by training over 1,375 districts and hospital leaders countrywide in health supply chain leadership, management, and governance. This enhanced national supply chain leadership and governance capacity and is yielding positive results. For example, the health supply chain reporting from 30% in May 2022 to 80% in April 2024. Digitalization of the supply chain has been enhanced with the following. 53 facilities supported to use the government-approved electronic medical records, which we call the electronic medical records. 1,434 provided with digital supply chain infrastructure, and 1,947 facilities ordering digitally. Under Ministry of Public Service, through the 10-year advocacy efforts, the human resource structure for the supply chain has been enhanced to include additional key personnel, while supply chain management at the district and health facility levels. District senior pharmacists, health facility pharmacists, and medical records and IT officers, among others, have also been included. These are now being recruited at the various levels and are expected to further consolidate gains in the supply chain management. We could give some advice to our partners, our colleagues from other countries who are looking forward to using this method. And the advice is that you need to have a long-term roadmap. And this is essential to address strategic priorities in the short and medium and long term. For a roadmap to be effectively implemented, there is need to obtain technical and political ownership from all stakeholders through an inclusive development process. It's also critical to ensure alignment of the roadmap with broader national and sectoral strategic frameworks that will ensure any operational plans are implemented and are in alignment. And finally, we need to continue to coordinate and work together and break the silos and plan together, implement together, monitor together, and evaluate together. And again, do performance improvement plans together, which we can all work together to achieve. So thank you very much. These are the small of the issues that I can share with you in the meantime.
Okay, thanks, Commissioner Walogembe, standing in there for Musimenta Boaz, a principal policy analyst. I must just remind our audience that Mr. Musimenta traveled out of town for a burial and is in a bad network area. The network is poor, but he says he will shortly join the panel. Let's hear from Dr. Victoria Nachiganda now, who is a program management specialist with supply chain in at the USAID Uganda office. Dr. Nachiganda?
Thank you very much, Mr. Moderator. So USAID is pleased to be part of the journey, and since this roadmap is really led by the government of Uganda, USAID shall not be making any remarks. It's only right and proper that the government of Uganda really leads this. So back to you, Mr. Moderator.
Thank you. Thank you very much, Doctor. That's a good one. I already have someone called, I think, Wawira Moni, who is saying, please explain how the increase in funding for commodities is attributable to the HSC roadmap. To what end did the roadmap play a role? Who is going to go for that question among the panelists? Can I give it to Mr. Dr. Lugada Eric?
Yeah, thank you. Thank you, Charles. One of the things, as we said, within the interministerial task force, the Minister of Finance is directly represented in that task force. And they were part of the planning process and the quantification. Part of the support that the USAID strengthened supply chain activity provided to the government of Uganda is to enable them to properly quantify based on consumption data in the country. And to this end, we were able to support the partial automation of the quantification process, we're able to estimate clearly the ARVs, the different baskets of medicines we needed for malaria, for ARVs, and for emergency medicines as well as essential medicines. And beginning 2022, the government began to increase their funding levels. We have letters, they even made a commitment to USAID. They increased the budget to about 11, if I remember correctly, about 11 billion to purchase antiretroviral drugs. They also added money to buy essential medicine and health supplies. That was last year. And this year, they've increased that budget yet again. So we've seen a potential increment, and that has been because they are part of the interministerial task force. We advocate to them directly, and then they go to plan for the annual budgets of the country. They've taken into supply chain needs into their fold while they are planning. So yes, we've had a direct impact on the budget implementing in health for supply chain by the government of Uganda.
To Commissioner Walugembe, there are targets that have been set for the roadmap at 3 years, at 7 years, and then at 10 years. From the developments going on, you earlier indicated that initially, when the roadmap was commissioned, when it was launched, we were at about 500 or thereabout billion shillings in terms of the funding. As we talk, we have just crossed about 740 billion, which still puts Uganda at about at less than 30%, perhaps. How do you think, or what do you think government of Uganda should be doing, first of all, to achieve the 3 years, which I think is this year or next year, early next year, because this roadmap was launched in January, if I'm not wrong. So by January 2025, it will be 3 or 4 years. So will we have even achieved the third year target? What should be done in order for us to achieve the target set out for the 3 years, at 7 years, and at 10? Mr. Walugembe?
Thank you very much. It's a tough journey to walk. We shall continue to engage internally as government and also with our partners to make sure that we implement our targets as planned. Of course, the issue of resources still remains as a thorn, but we are going to remain committed and work towards achieving the targets. Those which need resources, of course, it also depends on how the economy performs. But we trust, because this is a very important area in terms of human capital development in the country, we shall continue to engage and perhaps get the resources. But also, apart from getting the resources, of course, there are other areas that we need to work on, which may make us reduce some expenditures somehow. Because, for example, if we can undertake approaches that reduce the disease burden, or the preventable diseases can be looked at. But most importantly, in terms of the supply chain targets, we are going to continue to focus on them until we achieve them.
There is a gentleman called James Olweny. He is asking, what is the future of health commodity financing in light of the national health insurance plans? Is it good or bad? Dr. Victoria, can you help us answer that? Dr. Victoria Nachiganda?
Yes, please. Thank you for that question. So in terms of financing, there is been increased advocacy towards the government of Uganda to increase financing. And I think that is really a step in the right direction. We also have the different development partners that have continued to fund and are still continuing to fund these commodities. So service delivery shall still continue. Back to you, moderator.
Thank you, Doctor. Another one is called Ronald Okello. He asks, how shall we strengthen the capacity of supply chain managers, of staffs who aren't trained in supply chain management, who are the majority in lower levels of care, in public health facilities, especially nurses who are usually rotated on a yearly basis by the lower government. Dr. Martha Geelong, can you please respond to that?
Thank you very much, Mr. Hill, for your question. The good news that we have is that the Ministry of Public Service has opened up. We have now a new structure, and the Ministry of Finance, Economic Planning and Development is going to, as promised, to provide funding to recruit health supply chain staff. Yes, we have been having nurses. They have been helping us to do that work. But now that we have this new structure that has the pharmacy technicians at the health center 3 level, then the pharmacist at the health center 4 level, and district senior pharmacist at the district. So these staffs will be able to help out in that area. Thank you.
Okay, Dr. Martha, thanks a lot. There is a question here that must be very close to my heart as a communications person. It is from Henry Komakech. He asks, how is the 10-year roadmap being effectively communicated? Those are two very important words. There is the effectiveness and then the communication bit, and implemented in health facilities. Who is going to answer that for us? Can I get
Martin?
Martin,
thank you. Yeah. Thank you very much, Charles. We have an elaborate process that has already started as soon as the roadmap was launched. An elaborate process was put in place, and it is a continuous element in all engagements we have with the leaders at district level, national and district level. And at district level, we are talking about the political and administrative, as well as the technical leadership at the district level. As we speak to the leadership, governance, and support, technical support to the health facilities, to the district leaders, we do make this in line and advise that the supply chain is governed through the 10-year roadmap. Each of the leaders in the districts and in the facilities is then run through the key elements of the supply chain, of the 10-year roadmap, and then a copy of the roadmap shared with them accordingly. We do engage at very frequent levels, monthly and quarterly levels, with our colleagues, the implementing partners who are last mile in the provision of technical assistance to the facilities and districts, who also relay the same information, disseminate as well as communicate the content, the priorities within the roadmap. So this continues through the year, and we are transitioning this as we move forward to not only the implementing partners, but to the regional tier of the health system, regional referral hospitals, who are part of government, who will then at subnational level continue to make sure that this document is communicated, the content shared, and the planning needed by the districts actually done at the highest level and the lowest level possible within the district health system. Thank you.
Charles, if I may add, thank you, Martin. Let me add, Charles. On a broader view, the roadmap, the 10-year roadmap is just one of a strategy we have used. But on the broader view, we have developed training materials which build the capacity and enhance capacity of all health workers, both at the district leadership, the health facility, and these materials have been made into digital print and they are hoisted in the Ministry of Health website. So all health facilities, all district leadership can log on, train themselves and self-examine themselves as an offshot. And that's the second strategy in addition to the 10-year roadmap. So it's beyond the 10-year roadmap. And the Ministry of Health is popularizing them and asking both districts and health facilities to do self-learning. The material is existence and we could share the links after this, and they are open to the entire public and the health community throughout the country.
Thank you, Doctor. Doctor, you have another question that someone called William Mutabazi from Baylor Foundation is asking you, and he says, we have just had engagements with district leaders and health facility teams, and we appreciate all efforts by USAID SSCS to digitalize commodity management. However, we need to push district leadership, increase ownership of digitalization of efforts. CAO's district health officers need to have individual performance objectives on health commodity digitalization with the target of 95% of their HFs, with the funny functional digital systems, system malfunctions measured on proportional of tracer commodities, whose physical stocks match data in digital systems. That's from Mr. William Mutabazi. Dr. Eric, please.
Thank you, William, and that's a great observation. I think over the last 3 years, we have done exactly that. When the program started, we initially had just about 300 health facilities which had digital platforms. By digital platforms, we mean computers and which are wired within the health facility to link the hospital store to the dispensing unit. Currently, through funding from USAID and the Global Fund jointly, we've been able to increase the digital presence of computers to take stock status of health facilities to about 1,200. The reporting rate of essential tracer commodities, which are 41, was at less than 20% in 2020. To date, over 95, 85, close to 85, sometimes 95% of all health facilities in the country are consistently reporting their stock status at the health facility level, which we, through the DHIS, which is the National Digital Reporting Platform. Now, over time, we've been training district administrators, DHOs to monitor the reporting rates of the health facilities within their districts. Again, anchored along strengthen the supply chain system, but also using the 10-year roadmap. And one of the things we have done in collaboration with other USAID-funded implementing partners in the country, we've been able to introduce technical working groups all over the country in region. And the technical working groups are increasingly engaging the district administrators, engaging the district health officers, including hospital administrators. First of all, to download the information, it's available in the Ministry of Health website portal in dashboards, and they are downloading the dashboards themselves, discussing the performance at the district and at regional level, and then directing and supporting their own district, the regional referrals, to improve performance. So that's happening, and it's part of the 10-year roadmap, which is not only to build capacity, enhance capacity at the national level, but at the sub-national level, empowering district administrators. Well, they are responsible for the function, the proper functioning of health facilities with oversight from the Ministry of Health to make sure that they are doing the right thing. And we've seen a tremendous improvement, especially in reporting based, and now decisions are beginning to be made based on stock data, using data which we are collecting from the health facilities at the moment.
Thank you very much, Dr. Eric. Can I ask Dennis Okidi to respond to Richard Chakua Juko, who is asking how the 10-year roadmap will integrate the use of continuous quality improvement in the management of health supplies among different stakeholders. Dennis Okidi.
Yeah, thank you very much, Charles. And thank you, Juko, for the question. So I think part of the 10-year health supply chain roadmap is really a pillar on really improving management of health commodities at health facilities. And continuous quality improvement is really one of the many approaches that is being implemented and planned for scale up to all facilities. You do know that in the last 4 to 5 years, we've been implementing a comprehensive strategy that was really tailored at getting district-led supervision to health facilities where they do continuous performance assessments and agree on really tailor-made implementation plans. Now, with capacity that has been built at the level of the facilities, we're now looking at facilities taking charge of their own performance assessments and quality improvement planning through a digital supply chain performance assessment strategy. So part of which has been incorporated in terms of planning for the long term to ensure that after the heavy investments in terms of digitalizing facilities, availability of data at facilities using the electronic medical records that are being scaled up, facilities will be able to assess their own performance from a supply chain standpoint and triangulate these with service delivery data that will give them a pointer on how well they are planning for their commodities with regard to their morbidity patterns. So that's an integral part of the 10-year health supply chain roadmap, and support will be provided through, of course, the districts now that have begun to plan for their supply chain activities in their district annual plans, as well as partners that are available to support. So yes, Juko, that's an integral part of the 10-year roadmap. Over to you, Charles.
Thank you, Dennis. Thanks a lot. Anne Nanyonjo is asking Dr. Martha, how can hospital management be engaged to clearly include supply chain activities in their work plans, as most hospitals only include procurement, leaving out other important activities related to supply, to the health supply chain? Dr. Martha?
Yes.
Dr. On? Oh, thank you. Thank you. I see you.
How do hospitals we have strategic documents.
Martha, you're not very clear.
We have the National Pharmaceutical Services Sector Plan. Can you hear me?
Yes, you're better. You're better.
I'm better now.
Yeah.
So for us, to have these activities included in the work plans of the hospital, through the guidance from the hospital management, and also the documents, the strategic documents that the health supply chain roadmap is anchored in. One of them is the National Pharmaceutical Health Services Sector Plan. So we can include these activities through this document, and all these activities are already stipulated in the document. It is just the hospital to pick out what they can have, they can implement. And then Dennis has already talked about the quality improvement aspects. We already have the quality improvement aspect, that is supervision, performance assessment, and recognition strategy, the SPAS. These tools are all digitalized tools, and we can use that to anchor the health supply chain activities in the hospital. Thank you.
Okay, Kalim, there is another question from Kalim Wangoye, and is asking Commissioner Walugembe, is there a specific funding line that is needed to manage supply chain activities in the hospitals? And he says, note, the PHC funds are only restricted to other health activities other than supply chain. Mr. Commissioner?
Thank you very much. The funding line, I think the most important thing is for us to plan for it. The most important thing for us is to plan for it, and we engage. The most, rather, when we as partners see that fit, I think we can take that forward. But in the current arrangement, we use the existing chart of accounts. So it is something that we can engage if there is need and if we push for it. Over.
Okay, then there is a question from someone called Justin Okwairot. I'm going to take this question and then I will pick some hands for comments, for audio comments to come through as well. But this is Justin Okwairot is asking, before Justin, there is a question by Edith Namakula. I think that question should be answered by Oteba. Has this roadmap been disseminated to all health facilities? Secondly, has the ministry been able to sensitize health workers to take part in this roadmap in order to achieve these three objectives? Mr. Oteba, you can answer the first part, and if you like, you can pass the second part of the ministry sensitizing health workers to Dr. Martha. Is that okay?
Thank you, Charles. I think Dr. Martha could really answer this question. So the part of it was partly answered, the first one.
Yeah.
The process is ongoing.
Yeah.
We've started, as was mentioned by Dr. Eric Lugard earlier. We started with the central level, planned to roll out. We've been rolling out to the district leadership, hospital leadership, both at the regional and the general hospital level. And now, the Ministry of Health, working together with the regional referral hospitals and the partners at the last mile level, are working with the last level, which is the health facility and the leadership there, to make sure that they understand what the roadmap is, what is entailed in there, and what is expected of them. But Martha could do further enhance this as she answers the second part of it. Martha, over to you.
Martha?
Thank you so much. Yes. Thank you very much, Edith. As Mr. Oteba has already said, sensitization is ongoing, and we are already into the third year of implementation of the health supply chain roadmap. We have already sensitized over almost all the districts, the 136 districts, and the results are, we have already, you heard from Dr. Wangebe. From the results, we've seen that there is an improvement and the sensitization is still ongoing. And we have reached all the hospitals, the district hospitals, the health facilities through the leadership. And they have appreciated what the 10-year health supply chain roadmap is bringing in. And actually, they were very happy to note that they didn't know before what the supply chain is all about. They thought it was just buying commodities and that was that. But the supply chain 10-year health supply chain roadmap has opened the leadership in the districts, in the hospitals, to ensure that we incorporate this work into the work plans of the districts and the hospitals, and this is being done. And a circular was already sent out by the Minister of Health to have these activities of supply chain incorporated into the work plans. And that is so far, that is what is ongoing.
Okay, there is a hand that has been up for some time of Andrew Kagwa. Andrew, can you come on board and ask your question or make your comment? Andrew? Andrew Kagwa, are you still online? Andrew, can you unmute? Okay.
Hello?
Yes, Andrew?
Hello? Yes, thank you so much, Mr. Dongtho, for the opportunity. And I'm glad that these discussions are starting to come to the public. For me, it is an opportunity to talk about the things that I really enjoy talking about. Thank you, USAID, thank you, OPM, thank you, MSH, and everyone for the effort. I have a few questions or comments about the day's discussion. The first one is, I'm glad that the strategy is taking into, is concerned about digitalization, which is a great disruption and the way to go. How about sustainability? How is the strategy going to push for sustainability within the supply chain, the supply chain in the country? I feel it's a big thing that we may want to think about as we keep in tandem with the global movements. Then I wanted to know whether a baseline was carried out for comparison, because it will give us the challenges then and what challenges are there now and how the objectives have been met. I think it would be a great idea. Then how is the strategy positioned to move expenditure for the whole supply chain from the support activities like meetings and wages to the core requirements like commodities and such things? I feel many a time in the LDCs, we spend much of the funds on support areas, yet the core areas are really a big thing. Then to my colleague at the ministry, the Assistant Commissioner, I wanted to inform you that the Ministry of Finance is taking leadership in the drafting of a bill for the Institute of Procurement and Supply Chain Management. Just like how you see ICPAU, how you see Uganda Law Society, there is a drive towards also trying to control this area. It is at bill level being drafted. I believe the colleagues in this fraternity should have some kind of interest in acclimatizing themselves with what is going on and the contents of that bill, so that by the time it is passed, it has some input from them. There is a procurement policy and management department that is taking stewardship in this, and the Ministry of Finance is funding it. I think for now, that is what I want to talk about. I thank you so much.
Thank you, Andrew, for those questions. Dr. Eric, can you answer the questions on sustainability, baseline, and commodities, and then leave the other part to Martha?
Okay, thank you, Charles. Indeed, thank you so much for your comments. I think sustainability has been fully taken care of. First of all, we've taken the approach of the one government, where we have gotten all the 9 ministries responsible or which have any impact or influence to healthcare and supply chain have been taken into account. Like we mentioned earlier on, we played advocacy role with the Minister of Finance, and we are requesting the funding decisions to be made based on data, but determined from the budget level. And if you may, it may be of interest to you, we might post for those who are interested. For the last 2 years, the budget circular from the Minister of Finance has a clause specifically related to supply chain services in the country. It's asking and requesting the Ministry of Local Government to ask all districts to budget and plan for activities that will support supply chain services within the district and health facilities that will enhance its maintenance and also its proper function. So that we think will be a sustained process which will help. But also, in addition, the Ministry of Local Government has been sending out circulars from the Permanent Secretary requesting all district administrators to request health facilities and their district health officers to plan, put into the district and hospital annual plans, supply chain activities, and also fund them, budget for them, so that they are funded through the regular national cycles. And we believe if that continues in the next 10 years, it will promote sustainability. The Minister of Information, Communication and Technology is part of the team. And in order to maintain the equipment that we bought for the district, the first thing we did, which was a departure from what we normally do within USAID funded programs and Global Fund, day one, all these computers, internet connectivity, commodities we bought were handed over the district, and they were owned by the Ministry of Local Government in all districts, and they've been labeled. And so part of the financing is to support maintenance. So the Ministry of Information, Communication and Technology to date has seconded one ICT officer to each of the 138 districts in this country to support maintenance of these equipment, because they are now owned by the government. They've been moved from the hands of the donor to the government, and we believe that's a testament. And to wrap it all, when we started, we did baseline surveys. There was the national the national supply chain performance assessment that was done, I think, in 2018. It was on that basis that this activity was developed and coined by USAID. And based on that assessment, many indicators indicated low performance, and we've been tasked to improve them. And one of the glaring indicators was the reporting rates of the country, which reported stock status. Initially, we had no visibility whatsoever of what commodities we have in the country, what is stocked out, what is understocked, what is overstocked. I'm happy to report today, 3 years down the line, we've improved that reporting from less than 20% to now close to 90% monthly. And there's a trend analysis which shows continuous improvement. And we've started to use data now, not only to inform the quantification, planning, and procurement of commodities in the country, but also to inform the distribution and sustainability of commodity availability, both in the national medical stores and in the health facility stores. If you go to the Ministry of Health website, there are already 2 digital platforms there which have dashboards. One dashboard shows you the online stock status of all essential medicine and health commodities in the central warehouse, that's the National Medical Warehouse and the Joint Medical Store. The National Medical Store and the Joint Medical Store. We are now online. We also have another dashboard which shows the current stock status in all health facilities in the country. You can break it down by district, by region, and by health facility. So we have those 2 stock status currently running on the Ministry of Health website. So we are using data. We are beginning to use data to show data and accounting for commodities available in our country. And we believe that will really drive us toward sustainability. Now, to address the other core elements you mentioned, like human resource, we mentioned that the Ministry of Public Services, part of the collaboration, interministerial collaboration, they've provided provision of pharmacists to be hired at all districts in the country. They've provided for health store managers at all health facilities to be hired, and the Ministry of Finance, after the ban on recruitment opens up, they will be hiring these officials who are specifically hired to manage supply chain. And then I've mentioned the funding is already there. So we're encouraging all districts to put in their annual budgets and ask Ministry of Finance to provide resources to manage the mentorship, to manage the maintenance, and to support continuous reporting at health facilities throughout there. So that all is happening within this 10-year roadmap process. And it has happened in the last 3 years.
Dr. Eric, why are you referring to 138 districts and you're saying all the districts? We have 146. Which are these 8 that are not supposed to be catered for?
Unfortunately, the district numbers change almost every day, so I apologize if I haven't kept track of how many they are today. They could probably be 160 by the time we get to tomorrow, but all districts are being covered.
Okay, thank you so much, Dr. Eric.
Yes, Chair, Moderator.
Dr. Martha, you had
There was
part
an
of
issue of sustainability.
Thank you. Come for it.
On sustainability, what the essence of this 10-year health supply chain roadmap, we are heading to self-reliance. We want Uganda to be the health supply chains to be sustainable through we become self-reliant. You know, right now we are heavily donor funded. So that's why this roadmap was developed and it's being implemented in first year, short term, medium, and long term. So what we are talking about now, what we are bringing in is the medium, the first 3 years, what we have done in the first 3 years. And we have already given you the results of the first 3 years. We have all the ministries that are very key in ensuring that we sustain the health supply chains in Uganda. We work together with the Ministry of Information, Communication and Technology. That is very key in ensuring that we have the internet services. We have the Ministry of Energy and Mineral Development. We need power in these facilities for sustaining the health supply chain. We need Ministry of Health and Ministry of Finance and Economic Planning and Economic Development, Ministry of Public Service, and the National Planning Authority. These are very key in ensuring that we sustain the health supply chains in this country, and this document will be sustained. We are heading there. So we need to become prosperous and become self-reliant. So we need the government, we have indicators that we monitor on a quarterly basis. So the interministerial task force team sits on a quarterly basis and we monitor progress to see how all the different ministries, departments, and agencies are moving on to ensure that we have the activities of the 10-year health supply chain roadmap done. Thank you.
Okay, we have a question from Justin Okwairoth. Panelists, I know that our time is running fast and the questions are so many. So I will ask us to just move fast with the answers so that we can answer as many as possible to the satisfaction of the audience. But now there is a question from Justin Okwairoth, who is asking Martha that storage is critical for health supplies, security, and yet local governments are constrained with developing budgets to undertake expensive projects like major renovations at the district health facilities. Is the central government prepared to undertake these works? In Nebi Hospital, for example, the store is 51 years old and require a facelift to meet the current need. Martha, doctor?
Thank you very much. We have the Ministry of Local Government. We work together with the Ministry of Local Government and the Global Fund, that is we work with the Global Fund as pledged to renovate a number of health facility stores. And I believe Nebi is one of them that is going to be renovated. And we have also bought, through the global support from the Global Fund, bought shelves for the storage of commodities. So that one is in the pipeline. It shall be done. Thank you.
Okay. Gertrude Nasike asked a question which had already been asked on sustainability. I don't know, but let me still ask it. What sustainability measures are in place to ensure the 10-year roadmap efforts are sustained over time? And this is going to Dr. Victoria.
Sustainability, thank you very much. So sustainability, one of the discussions we are having right now is actually about sustainability. So you couldn't be more timely. So in terms of sustainability, one, the key issue about sustainability is not just ending donor funding and then government takes over. No, that's far from it. It is government being in charge and supporting all the activities that they're doing, even with the development partners in place. So the roadmap is really a step in the right direction with clear milestones on what needs to be done and what more the government needs to do in terms of being in control of what they should be doing. Back to you, moderator.
Thank you, Dr. Victoria. Dr. Eric, there is another question for you here from Mr. Pradeep Patel, and he asks, we are entering into Industry Revolution 5.0. Can you elaborate what are the key points we are considering for a 10-year roadmap with respect to artificial intelligence, automation and tracking, cold chain, controlled community and reverse supply chain returns?
Thank you so much, Mr. Pradeep. I think you will agree with me that where we still are, sadly, in most of the African countries, we're still stuck in Industrial Revolution 3, or probably 2. Even access to computers is still a challenge for us. We haven't yet learned to use big data, not even collect simple data. So it's going to be a step. We are almost running through a phase where we are doing AI, but at the same time, we are trying to digitize all our health facilities. We only have about 23 hospitals in our country, which have an integrated medical record system running. So we are not yet there, but we are beginning to introduce digital platforms. We have over 5,000 health facilities in this country, and less than 1,000 have digital platforms. So we are now where we haven't yet reached a level where health facilities will start using AI to inform most of stock availability, cold chain tracking. No, we are not yet there. We probably are 10 to 20 years away from Industrial Revolution 5.
Thank you, Eric, for that honesty. There is another question from Ndinda Kusu, and is asking Commissioner Walugembe, does the 10-year health supply chain roadmap incorporate and fund any regulatory aspects being implemented by the Uganda FDA? Is there a governance structure for this roadmap that reviews progress on a regular basis? Mr. Walugembe?
Thank you, moderator. I would answer in the affirmative that our roadmap and implementation arrangements have been clearly thought through, and the regular meetings which we have do a lot of reviews and improvements in whatever we do. So we shall continue to review and again determine gaps wherever they are and come up with them concurrently and consultatively.
Okay, while with you, Commissioner, also Richard Anguzu says, what's the strategy in place to ensure other MDAs effectively embrace the One Health approach in their day-to-day activities for comprehensive reporting, as opposed to the current state where One Health seems to be an issue of Ministry of Health as per progress report received from OPM? Can we broaden this and make a more comprehensive report in the next stakeholders meeting?
Yeah, thank you. I think the important thing for us to do is to deepen the program approach which we are using as a country, moving away from the silos, the sectors, and work together. So the program approach is a step in the right direction, and that will deepen the working together. And once you do the reports and the plans on the program in a programmatic way, then the itinerant reporting is done accordingly. Over.
Thank you. Dennis Okidi, Ndenawe John Mark is asking, I would like to know how the private sector supply chain partners are being involved in the 10-year plan.
Yeah, thank you, Charles. So I think one of the pillars, again, of the 10-year roadmap is actually private sector engagement. As you're all aware, the 10-year roadmap was developed with the main objective of really incrementally increasing resources for the health supply chain. And the health supply chain is composed of both the public and the private sector. And these need to be harnessed to actually give the common good that is required to assure availability. So the private sector really is an integral part of the 10-year roadmap programming, with actually a whole pillar detailed to harnessing private sector capability, strength for the common good of the national health supply chain. So the private sector is really an integral part. Thank you, and back to you, Charles.
We should be winding up in the next 2 or 3 minutes. Dr. Martha, there is a question from Odor Joe, and he asks, has there been any attempt by the Ministry of Health to organize such an engagement like the one we are having now with the various district leadership to communicate this message beyond letters and engagements being provided by the IPs to the districts?
Thank you very much. This is the first of its kind. More webinars will come. This one has been general. So now we shall start moving to specific strategic areas, because there are so many strategic areas. We have 8 pillars. So we shall start having webinars on according to the strategic areas in the 10-year health supply chain roadmap. So that is going to be done.
Dr. Eric Samuel Becker Lukwia is asking on digitization, and he says, currently we have so many disintegrated digital systems and also not interoperable, yet some are still in infancy of its terms of maturity. Looking at the 7 years remaining, how are we going to enhance integration, or do we hope to acquire a more comprehensive one that covers all aspects of supply chain management?
Thank you so much, Lukuya, for the question. To answer that question is that supply chain doesn't stand alone. Supply chain is part and parcel of comprehensive clinical care that we provide to our patients. So we have clinic data, we have laboratory data, and then we have the supply chain data, which is the medicine. Now, the Ministry of Health has taken lead, and now they are moving towards an integrated electronic medical record system for all health facilities, which will also include human resource and operational aspects. So through that, it's very difficult to get a comprehensive system, but we are working and supporting the Ministry of Health, including other USAID and CDC-funded partners, to form bridges, interoperability in the back end, so that the national health database can link supply chain data to clinical data, to laboratory data, to supplies data, and also to operation and human resource data. So that's happening. It's not going to turn green overnight. It's not going to take 1 year, 5 years, I doubt, but it will take place. And right now, we might look at 10 years, 15 years from now for it to be fully implemented. That is happening.
Okay, we are now coming to a close, but there is a question by Bistras Zeleva, can Dr. Nachiganda respond to this? Sheleva is saying, can the speakers share if there is any progress and experience with specialized supplies, such as those needed for heart surgery? It's a continuous problem across all of Africa.
Mr. Moderator, I think the Ministry of Health is best placed to respond to that, so I will pass it on to Dr. Martha.
Martha, come back.
Thank you very much.
You can't escape, Martha.
We have said this 10-year health supply chain roadmap is the essence is for self-reliance. So all this is covered, and all these specialized supplies, such as those needed in heart surgery, we need the funding. And the Ministry of Finance and Planning and Economic Development is a co-chair to the Interministerial Task Force that is which is monitoring the 10-year health supply chain roadmap, and they have pledged to continue supporting and providing funding for the commodities. And that is where we are heading. We want to have sustainable funding for the health commodities in this country. Thank you.
Thank you very much. I think we have come to the end of today's webinar, and it has been an interesting one, very exciting indeed. And I just want to say that we will be sharing a link for the roadmap in the chat box for more information. But also the next webinar will delve into digitization of health supply chain. And we shall be sending out to you the communication for that in due course. But I want to thank the Office of the Prime Minister, and especially the Department of Communication and Implementation, for coordinating this together with the Ministry of Health, the other MDAs, and the USAID-funded Uganda Strengthening Supply Chain Systems activity, and all the other partners that have come together to make this a reality. The Management Sciences for Health, of course, that has hosted us, and the Advocates Coalition for Development and the Environment, and the Uganda Health Care Federation. Thank you very much, and especially to our very good panelists. Thank you very much. And to all the guys who made this possible, especially those working out the technical facilities that has made this possible. Thank you very much, and God bless you all. Bye-bye.
Thank you, and bye-bye.
Thank you and bye.